Welcome to 20-Minute Health Talk, where some of the brightest minds in healthcare help us break down the latest news and developments. I'm Rob Hoyle, joining virtually this time. And on the other side in the studio is my co-host, Chris Gazewski. And we're joined with our special guest, Dr. John D'Angelo, who is the Chief of Integrated Operations at Northwell Health. John, thank you so much for joining us. And tell us, how is data helping us stay one step ahead of this war against COVID?
Well, thanks. It's been very helpful. What we've learned through retrospectively looking at the experience back in the spring was that we saw volumes of certain types of disease, certain types of chief complaints, much higher than any other flu season prior. And looking at the pattern of presentations, the pattern of complaints, the pattern of diagnoses, it allowed us to kind of create triggers early on, after the first wave, that we would watch daily and get alerted to, an unusual spike in that type of activity. The biggest reason you want to have as much advanced warning as possible is because there's so many moving parts on how you manage the surge. You have to make sure you don't know where it's going to be. So last time it was Queens, Forest Hills, Valley Stream, those areas we got hit the hardest. This time around, it was Staten Island initially was the area we hit the hardest, and we're seeing high rates now in Suffolk compared to, let's say, Manhattan. So the data helps us understand where we need to react, and it's a balancing act. There's many levers. There's space, staffing, equipment, and supplies. The equipment and supplies piece of the equation, we are very well ahead of. Unlike the first time when we got hit really hard and really fast, we've had now time to prepare. So we are well prepared in the equipment and supply area.
Dr. D'Angelo, how does this data help staff react to everything that's going on? Does it also give them a little bit of hope knowing what to expect? And how does it help them just in their everyday jobs be able to deal with what's going on?
I think it's both the data and the planning. I think it's important for the staff to know the level of planning that's gone into preparing for a resurgence. And the data helps us monitor what point of action is needed, depending on where we're at, where we think we're going. But I think more importantly, I think they hopefully find more sense of calm, knowing that, A, it's not going to be like it was before, and B, we are so much better prepared. I mean, nobody was prepared in the spring for what we were dealing with.
Can this be used for other illnesses? Are these still some of the lessons that we're learning and how we can adapt it to whatever's to come ahead?
Yeah, I think you can build like biosurveillance tools based on the same methodology. And it's not much different than the flu surveillance. It's just we're looking for a different, compilation of different diagnosis or chief complaints that prove to be possibility of being COVID.
And that brings us to our top three.
What do you feel as if the top three impacting this situation is?
All right. So what's impacting our current situation? I think it's there's going to be continued spread because, we don't have that herd immunity yet. The other things I think that I take out of this that are really inspiring is, again, I got to go back to the grit and the resiliency of our staff. And I think we haven't had to do so yet. But in the first wave, we called upon people to come from ambulatory to hospital, to work in ICUs, to do all sorts of things that were out of their comfort zone, and people stood up and did it. And I still feel that the culture of Northwell and the dedication of the staff is something to be very proud of, and that gets us through all these types of situations.
Anything else impacting the field?
Yeah, I tell you, my hat's off to the people that are doing all the work on the vaccine through our employee health, HR, the pharmacy folks. It's a tremendous undertaking. The employee piece is moving really smooth, and I believe the overall general public one will as well, but there's so many more moving parts in that arena.
Obviously, Northwell Health is a large health system, but there's so many other hospitals and health systems and so many other organizations that are battling this pandemic. Did we partner with other organizations and collaborate with this new data and how we predict things? And was it helpful to others as well as their input helpful to us?
Yeah, in many different ways. Lately, we've been working a lot with other hospitals in the region on their surge plans, on creating transfer agreements so that if any hospital in the region, even if it's not a Northwell hospital, becomes overwhelmed, that we can put into effect what we call load balancing and helping them decant patients if they have more than they can handle. So there's been a lot of collaboration with outside the system as well.
All right, as we're coming to a close here on 20-Minute Health Talk, we always like to end each show on a positive note. So Dr. D'Angelo, what gives you hope? What gives you optimism moving forward?
Yeah, I think I have a lot of hope around this being our second and not as severe of a wave. And that at the other side of that hill, we're going to hopefully be, soon looking in the rearview mirror, thanks to the vaccination program, as well as, everybody staying diligent with all the measures that have been put into place that helped us get to where we are today. And the vaccinations are going to bring us to the end of the tunnel. So I'm very hopeful.
Just on a personal note, what's the first thing you're going to do when this is all over?
According to my wife, we're going to travel because we've already canceled like 3 or 4 trips. So yeah, we'll rebook one of those trips and probably get out of here for a while.
Well, Dr. D'Angelo, thank you so much for joining us here on 20-Minute Health Talk. We really appreciate it. And for all the listeners who tuned in, thank you so much. Everyone have a great week, have a great month, and let's have a great year. Remember to stay safe.